Hannah Kale, and I'm one of the network education coordinators that works primarily with respiratory care. I am trained as a respiratory therapist. I went to school at a community college that had a 2-year respiratory degree program. With that degree, I was then eligible for my boards, and so I became a registered respiratory therapist. And my first job was working in a hospital setting, and I've primarily been hospital-based throughout my career. And in my current role as an education coordinator, again, I participate in all of the onboarding of staff, training respiratory therapists on our electronic health record, maintaining all of our staff files, and making sure everybody has what they need to do their job. Majority of respiratory therapists work in a hospital. And when you come to work every day, you usually stop at the respiratory department and you receive your assignment. And your general assignment could be anywhere in the hospital that day. It could be assigned to the emergency room, to the intensive care unit, to the neonatal intensive care unit, to just the general medical floors. So that's your general assignment, but anytime throughout the day, you could move into any one of those other areas and do respiratory care also. So any place that patients need help with their breathing, that's where respiratory therapists will be. It can look so different, not just from day to day, but from patient to patient. So we see patients all along the spectrum of acuity. And when we say acuity, we're really talking about how sick is someone. So somebody could come in and maybe they're just, their seasonal allergies are affecting them, and it's flaring up their asthma and they need help with breathing treatment. So you could be going into a patient's room, the patient could be walking, talking, breathing generally on their own, but they need some help with you helping them to deliver medications to them. And then additionally, you could see the sickest of our patients, which would be patients who are on life support. So going into those rooms, and the patient is usually sedated, but you're managing the mechanical ventilator that's helping them breathe right now. As a respiratory therapist, you can enter the profession with an associate's degree. There's plenty of associate degree programs in Central Texas as well as throughout the nation. However, generally speaking, the profession is trying to move towards a 4-year degree program. I would encourage anyone, even if you already have a 2-year degree or you're considering a 2-year degree, you get what you need to be a respiratory therapist in those 2 years. But to further your career in healthcare, a 4-year degree really does give you those skills that you need in business, in leadership, in communication, to be able to move your career forward. The technical skills for this job, it is a very fast-paced work environment, and it's generally, science and math-based. So understanding of chemistry, gas laws, physics, those types of things would really help you understand breathing in general and how medications affect breathing or how density of air affects breathing, those kinds of things. Other technical skills, there's a lot of equipment to be used. So if you're a person who likes taking things apart and putting things together or learning how things work, that can be really helpful. Also, a lot of our modalities of therapy are transitioning from mechanical systems to technological systems. So if you're somebody who's into computers and understanding how technology can improve the work that people do, that can be something that is very valuable. need to be very good at communication. You have to be able to talk to patients in order to provide them with education on their disease and how to take care of themselves or how to change their lifestyle to adapt to what they need based on how sick they are. And you also need to be able to talk to your peers in very high stress environments. The communication has to be clear, concise, and complete, and and safety of everyone depends on that, to be very good listeners. So we receive orders. Respiratory therapists work under physicians. So we receive orders for almost everything that we do with patients. And so when we receive orders, and this is part of what you'll learn in respiratory school as well, and in your clinicals when you're doing your schoolwork in the hospital, is how to not only listen to orders from a physician or any provider, but how to repeat those back in a way that is clear, and then your other counterpart, the provider, will confirm those orders so that we make sure that we're doing exactly what is wanted and needed for that patient at that time. I would say the most rewarding and the most challenging is kind of wrapped up into one thing. It's you are changing people's lives, you save people's lives, but with that being said, you're often right there at the patient's bedside for some of the most trying and difficult times in their lives. You're very often a part of when a patient passes away, you're there. And that part can be stressful, but it's also incredibly rewarding to provide that experience to a patient with dignity and be a part of that, very important time in someone's life or at the end of their life. You provide support not only to your patients, but to their family members. And so that can be very rewarding. And when patients walk out the door, it's very exciting to see how they've progressed from the time they came in the emergency department. Generally speaking, you've been with them in every phase of their illness or their recovery. And so when people do get better and they leave the hospital, that's also very rewarding as well. Researching healthcare careers, I didn't know very much about who the people were that worked in a hospital, but I knew that there had to be more than just doctors and nurses. And so I started researching who else worked in the hospital. I found that there were, a whole slew of laboratory professionals. There were a whole bunch of radiology professionals. And then there was also this other profession called respiratory care that I didn't know very much about. I ended up researching radiology more and requested admission to their program in my hometown. That program had a wait list, and someone offered or told me, one of the admissions counselors told me that they also had a program for respiratory care, and would I like to join that program instead. And I really wanted to go to school. I didn't want to have to wait. And so I joined the respiratory program. And I stayed with that position or with that profession because, I found out all of this amazing work that they do once I got into it. If you're thinking about a career in respiratory therapy, I would tell you to go for it, especially if you're someone who loves a job that is not monotonous, that you get to be involved in many different things in one day or in one shift. You get to be a part of saving people's lives. You should do it. Find a school in your area, whatever degree option works for you, 2 years or 4 years, both are going to provide you what you need to get into this profession. No matter what degree plan you choose, don't look at that as the end point. There's always a place for us to be continuing our education, whether that's within professional development within our organization, or professional development options you seek out on your own, or advanced degree options. You will never stop learning in this position.